Yes, hi. Hope everyone has a good day today. We are continuing with the topic of yesterday. Remember, yesterday we had one topic that was remaining that we did not cover. The topic was gender dysphoria. I had introduced what gender dysphoria is, and today we are going to finish this topic so that next week we embark on other things. Now, today we'll discuss about gender dysphoria. What is gender dysphoria? Gender dysphoria. It deals with personalities, mm, gender identity. Gender identity mostly deals with identity. What a person feels identity. What a feels he is confused between a woman and a man. See, here, as we speak, we can say gender dysphoria is a psychological condition in which a person experiences significant distress or impairment because of mismatch between their gender identity. Let's see, their gender identity, how they see themselves in terms of a woman or a man or bisexual, and the sex they were assigned at birth. That is what gender dysphoria is about. It's about uh, how a person sees himself in terms of gender. Is he a man or a woman? But he had already been given uh, an identity at birth. You see that in children for at least 6 months. This is when you want to diagnose. You will see these things in children for at least 6 months, and you see they cause depression. So, strong desire to be the other gender or insistence that one is the other gender at least 6 months plus in children. Preference for cross gender roles in play or fantasies. So when this person is in school and is in drama club or acting or so, you will find so much he wants to take a role of a woman. You see, preference for toys, games, activities, stereotype used by other gender. Yes, you associate most of what you are by other gender. First, before we continue on the gender dysphoria, on this topic of diagnosis and signs that we should look at to see, I would like to go to biological causes of gender dysphoria. What can make a person uh, have these problems? Like, what can make this person feels that I'm not a woman or I'm not a man? I should be the other gender or confused. Because when a person is born in every hospital, a person is given a gender. You are either male or female or cross gender. You understand? Mm. Yes, you are either male or female or cross gender. You get it? So we will know how to to deal with this. Sorry, network is going down and I'm trying to resolve. Yes. So, biological causes of gender dysphoria. Gender dysphoria refers to the physiological distress that results from mismatch between a gender identity and the assigned at birth. While exact cause is not fully understood, but there are some biological causes that we will look at that will make you understand that this is gender dysphoria. Research suggests that biological factors may be the cause, and it's taking the significant role in this condition that brings people to have problems. Now we see like Genetic factor is a cause. Family and twin studies indicate that there may be hereditable components to gender identity. Twins. You may find people are twins, a woman and a man, but one is more associated with being a man or being a woman. That is genetics. Some studies have shown higher concordance rates of gender dysphoria in identical twins compared to fraternal twins, suggest genetic influence. You get it? Some studies have shown higher concordance rate on gender dysphoria in identical twins compared to fraternal twins, suggesting gender influence. Specific genes or loci have not been definitely identified, but ongoing research is exploring genes like sex regulation and brain development. Some research, you see, this is a matter that is still on research. But when you go to hormonal influence during fetal development, hormone exposure during critical periods of prenatal development appears to influence gender identity. Prenatal androgens like testosterone. We talked about testosterone during early fetal development, particularly 6 to 12 years of age. Influence section differential. So if you have high testosterone, the child, you see, you can, you if you are, the child is female, this child may be female, but because of high testosterone at that age, as the child grows up, and the brain structure will take more components of a man, but physically this person is a female. You get it? There is a typical exposure of androgen, genetical like XX. You remember what we talked about, and XY. Hmm? Fetus. It may result in brain development that does not align with arranged sex. Yes, important. Conditions such as congenital adrenal hyperplasia. Those are conditions that may make a person have be confused on the gender. In genetics, female overproduction of androgens can lead to masculinized, masculinized genitalia. You get it? In genetic female, overproduction of androgens. You know androgens? Yes, those are like steroids, lead to masculinized genitalia and may influence gender identity towards traditional male behavior or identity. You get it? Now, brain structure and function. Brain, brain structure and function. Studies using neurological. These are studied using neurological and postmortem analysis suggests that bed nucleus of Seria terminalis central subdivision. You see the bed nucleus. This is the area of hypothalamus is involved in gender identity and sexual dimorphics. In the bed nucleus, this is where determination of gender identity is always produced. So if there is a problem there, you will find that there is confusion of a person be thinking that he's a man and he's not a man, he's a woman. The bed nucleus. The bed nucleus is under the hypothalamus. In transgender women, assigned male at birth identify as female. The size and number of neurons in the bed nucleus, in the hypothalamus, in the brain, the hypothalamus are similar to cisgender women. So you see, when you check the bed nucleus of the striaterminal central division, you will find the in transgender women, the size and number of neutrons in bed nucleus are similar to cisgender women. You check it. White matter, and then there is the other one which is white matter microstructure. Diffusion tensor imaging studies have shown that white matter pathway is transgender individual often always resemble those of their experienced gender. You see that epig- epignetic modification, epigmetic modification. Sometimes these words can be hard to pronounce, but you see, epigmatic modifications. Epigmatic involves changes in gene expression without altering the DNA sequence, often influenced by environmental factor. Prenatal stress, nutrition, and exposure to endocrine disruption chemical may influence genes related sex hormone receptors or brain development, potentially affecting gender identity. You see, prenatal stress, the woman's nutrition, exposure to endocrine disruptions like chemicals. When you're pregnant and you're moving around companies that are producing chemicals, they may mutate and go to your bed nucleus, as we've said, in the hypothalamus, the bed nucleus. And then there will be a problem in this thing. Intersex condition, disorders of sex development. Yes, disorders of sex development. Some intersex individuals are born with ambiguous genitalia or mismatch between chromosome and phenotypic sex. So this one may make a person to be confused on being a woman or a man because this is an intersex. But we have seen at the bed nucleus, uh, in the bed nucleus, there are more. If there is mutation, there will be a problem in production of androgens. So if androgens are being produced in your brain at high capacity, it means there will be a disruption also in the bed nucleus. So the genitalia of a person may be ambiguous. You see, if it's a woman, he may display a long clitoris, displaying maybe it's like a woman's penis. Yes. See, this is important information when you see people that are confused or talking like a lady or a man who is talking like a woman or a woman who has masculinity like a man. Today we know what is happening. We know that at the hypothalamus of the brain, there there is something called the bed nucleus of the stria terminalis central subdivision. Particularly, it is responsible for this one is responsible for sex definition. So the production of androgens at the bed nucleus may increase ambiguity in masculinity of a person, either a woman or a man. So you may present with ambiguous genitalia and character. Now, we check on the epigmatic modification. Prenatal stress, nutrition, exposure to endocrine disruption, chemicals may influence. You see, chemicals may disrupt by let's say what we call mutation. Mutation. Yes. We continue. Intersex conditions. Some intersex individuals are born with ambiguous genitalia. That one we've talked about. We go back to our topic. It will be a short topic today. We don't have a long topic like yesterday. So we see the characters that you may see so that you may know this is gender dysphoria. If you find someone is depressed at children for at least 6 months and above, strong desire to, to be the other gender or insistence that one is the other gender, prefer for cross-gender roles in plays or fantasies, you get it. Preference for toys, games, activities, stereotyping used by the other gender. A boy wanting to play with dolls, yes, at this age of 6 months and above, prefer to playmate with the other gender. Yes. Strong dislike of one's sexual anatomy. If you tell this child you have this as a boy, the child starts to cry. Mhm. Strong desire for primary and secondary sex characteristics that match one's experience and gender. You see that? Yes, 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 yes. Now we go to in adolescent and adults. When these are adolescents and adults, what can we see in adolescents and adults to know that there is this is gender dysphoria? At least two of what I'm going to say. If one has at least two of what I'm going to say, you'll know this person has gender dysphoria, and he she needs counseling at the age of adolescence for at least 6 months. In congruence between experience, expressed gender, and primary secondary sex characteristics. Strong desire to be rid of one's sex characteristics. Uh-huh. Strong desire for sex characteristics of the other gender. Mhm. Strong desire to be the other gender. Mhm. Strong desire to be treated as the other gender. You see, if one has at least two of those, you'll know he's undergoing a strong conviction that has typically feelings and reaction of the other gender. Now, if any of that, like two, you will know this person needs help. The problem is when we notice some people with some characteristics like these ones, we quickly start in some other places quickly start abusing them or saying heavy words against them. It's not correct. Now we understand biological in the basal structure of the hypothalamus is where all these problems start. They start from biologically from the brain, then they come out physically. So if we see these people and they need help, don't say that this person is not a good person or is not a straight person. This person is a good person. The only problem is what is coming down from the basal strata of the hypothalamus, and it's being displayed physically. It's being displayed physically. So we go on this topic. Causes we have said biological, psychological we can get cultural, familial, or early life experience can also contribute. Management and treatment. Management, psychological support and counseling, gender affirmation, hormonal therapy, e.g., estrogen or testosterone, so that it may regulate the hormone from the brain. You see, social transition support, change them, pronouncing close, you help transition. Yes, this is what we treat. Treatment aims to reduce stress and depression, reduce gender dysphoria, and improve quality of life, not to cure the identity itself. Yes, yes, important. No, no. Management of gender dysphoria we've talked about mostly is hormonal therapy like transferring estrogen when it comes to when you want to get to be a woman, transmasculine feminine testosterone when this person is identified as a man. We should use testosterone to help him become a real man. It requires monitoring. So you see, when you use this testosterone, always do hormonal balance, liver function, cardiovascular, and then we have puberty blocks, gonadotropin releasing hormone analogs, allow for identity exploration. You get it? Effects are reversible. The surgical intervention, you have always seen that people going to hospital to be transformed to the gender they want. We have seen that. Then there is social transition. Social transition is important so that this person cannot get stress, like changing names, pronouns, clothing, how this person is dressing. You see that school, workplace, Legal name they change, but it should be a multidisciplinary thing, like mental health professions, endocrinologist to know like those testosterone, estrogen, an endocrinologist should be part of it so that you will know how to transition this. Primary primary care providers, the caregivers at home that helps these people to transition. Surgical when needed, yes. Voice therapies, you understand, and social work. You continue supporting, but important ethical consideration. These things should be done at an informed consent to the parent if it's a child or an adult to sign an informed consent. And an informed consent is a consent that you've written down, you have explained. Some people give some time, you go and think about it, then you come, you talk about it again so that you be informed of the decision that you are going to make. Transition is not an easy thing to understand. Respect for individual autonomy and identity. Respect this person. Care should be non-judgmental, inclusive, and cultural sensitive. So when we see people behaving like homosexuals, lesbians, let's respect them and let's help them to transition to the gender that they want to have. Today it has been a very short um, video, and there is a confusion between someone asked if this person is attracted to the other sex. What does it mean being attracted to the other sex? You see, like let me take a person like a man and a man. You meet a person who is gender dysphoric, and as we have said here about biologically, a person displays characteristics of a woman because at the bed nucleus of the stria terminalis, it is producing more androgens. So if this stria terminalis is producing more androgens, this person may present as a man, and in really sense, he's presenting like his physical identity is a woman. So if this person gets another woman, another man who has low androgens and is more feminine, remember both of them are men, they'll be attracted to each other. You get it? So the being attracted to each other, what will happen? What will happen? They'll start being in a relationship. You get it? And this is an hypothesis, not yet proven, but you see, it makes sense. So when you meet these people, love them, help them in transition, help them in transition. If they need help to identify their personalities and they need help in identification of who they are, or I would really like you to help them. Now we go up here and summarize this topic of today. Like you will see the factors, causes of gender dysphoria, genetic factors, hormonal influence during fetal development, brain structure and functionality. That is where we have looked at the nucleus of stria terminalis. And then there we have BSD, the bed white matter microstructure. Two, the, the, the brain nucleus of the strata terminalis and the white matter structure. We have seen that. And then the fourth one, epigenic modifications. We have talked about it, intersex conditions. We have talked about that again. Now, let's not take this so far. Biologically, we have known why people can be attracted to same gender. Let's not be confused about it now, because now if you're producing, let me repeat, if you are producing more androgens in your brain and it is subjected to the hypothalamus, but the hypothalamus at a position called the bed nucleus, strata terminalis, if they are exposed to androgens a lot, and these androgens are, are the things that help to produce uh, testosterone, the hormone. I'm going so slow so that we understand these things. The hormone that produces what? Manhood. A woman may present as a man and may be attracted to men, but he meets another man who has low testosterone and produces low androgen. You see, they'll be attracted to each other. So two men are attracted to each other. And you see, this may cause confusion and depression in the first place. It may cause confusion. So let's not be confused. If you find someone has problems in these areas, let's help these people. And today it is short because other things to do. But if you have a question, always post it on my email. And that's the end of this video. Like, if you're watching, like and subscribe, and let's continue as everything, as every day. Remember, love is my religion. Stay blessed and stay cool.